everyone. This is Vince Jackson coming live from our studios in Central Florida. I would like to introduce Dr. Sarah Inman, who is joining us today for a podcast to talk a little about some of the challenges in the healthcare industry. So Sarah, if you don't mind, just jump in and introduce yourself and give a little background. That would be great.
Sure. So Dr. Sarah Inman, I am the Vice President of Healthcare Strategy at Improv and have spent about the last 20 years working in healthcare. So my doctorate focus is in healthcare administration. My research is on clinical staffing in particular. And I'm just somebody who has always really had an interest in how technology can optimize healthcare in particular and really take better care of the people who are taking care of the patients. So really excited to be here and answer some questions today.
Fantastic. So thank you for that introduction. How about we start off with just asking a few questions for people to get to know you and understand a little more about who you are and kind of what drives you and everything else. So let's start with why the podcast?
So I feel like this is a great opportunity to just connect with different people. Everybody enjoys different mediums of communication and getting their news, getting their information. Vince and I are both podcast fans ourselves, so we thought this was a really great way to share a lot of what's going on out in the field, out in the industry, and just connect with different people. So we're excited to share some information, then also connect with others who are doing really cool stuff in the workforce management space and get that information out to all of you.
Fantastic. So how did you get involved in healthcare to start with? Where did that come from?
Oh goodness, my very first job out of high school was a trauma medic at Vanderbilt Medical Center. And it really started, I was 5 years old and woke up one day with a fever. Had no idea where it came from and wound up spending 2 months in Miami Children's Hospital on a liver transplant list, only to wake up one day totally fine. And from then on, I was hooked. I saw what the nurses were able to do, what the doctors were able to do, and was absolutely fascinated by all things healthcare from that moment on. So spent a lot of my career at the bedside, taking care of patients, transitioned into clinical staffing, clinical leadership, and that's where I eventually made my way to then Kronos, now UKG, just sort of by chance from falling in love with staffing and what the technology platforms were able to do around clinical staffing. So it's been an interesting sort of circle that took me from the bedside to healthcare technology, if you will.
Absolutely, and that's a good marriage, right? You can usually truly leverage technology if you do it properly to help solve a lot of the challenges and problems that exist in healthcare and quite honestly in other industries as well. So on that note, let me ask you a question. If you could snap your finger and just fix one problem immediately in the healthcare industry, what would it be?
Oh, staffing. You will hear me talk about staffing so much. It really is a passion of mine, but it's also an area that frankly is just broken in the healthcare industry. And I think anybody you speak to at the bedside, any healthcare leader will acknowledge that from recruitment and retention to the number of nurses who are coming out of nursing schools, the number of doctors who are coming out of medical schools, and the number of people who are retiring, there's a significant crisis on our hands. And being able to find the best techniques and the best strategies to optimize existing staffing and make sure that the people who are out there on the floors taking care of patients have the right schedules they need, it is absolutely an obsession of mine. And it is something that I think would fix a whole lot of other problems if we were able to fix that.
Awesome. And I can't, I can't agree with you more than that. I mean, it's just, and obviously you have a significant passion about this. So how about we jump into some real questions around healthcare, right? They do face a lot of issues and a lot of challenges right now. Some people step back and say, well, healthcare hospitals are making tons of money, but I don't think most people understand the challenges that are going on behind the scenes, from regulations to requirements to insurance company impacts and all these things that influence the ability for to actually operate properly and effectively and efficiently.
Absolutely.
So let's jump into some of those questions if that sounds good.
Sure.
All right. So let's first start with workforce shortages, particularly nursing shortages. There's a massive issue going on in healthcare right now. How is technology helping to address this challenge?
It's absolutely critical, honestly, and I think it's probably the only reason we've been able to make any strides. Back when we were scheduling on paper or Excel documents and we were just slipping notes under the nurse manager's door, there was really no way to kind of get ahead of it and be reactive and plan. And that's what technology is enabling us to do now. We're able to optimize existing schedules, plan for the future, see where the needs are, even the ability to staff to acuity. So when we have these ebbs and flows in census where it's really, really busy, Vince and I being here in Central Florida, we see a lot of snowbirds in our area. So for hospitals to be able to leverage technology and those solutions to say, here are the months that we know we're going to get a lot of out-of-towners, we've got to staff up, we've got to staff accordingly. It enables us to be in a more proactive mode versus reactive firefighting, which unfortunately has been the case for so many years when it comes to healthcare staffing. So it really truly just lets us make the most of the team we have just through smarter planning.
Yeah, and that solves so many problems, doesn't it? And I don't think people understand too that sometimes it's those nurses and those people in those positions that are overly stressed because of the constraints and the availability and everything else. Right there, they'd be happier for more support and more resources than anyone in better scheduling. So let's talk about AI.
Oh yeah.
And how the automation to improve staffing efficiencies, and how do you think AI is going to affect the way we schedule and look at scheduling as we move forward?
It truly is going to have an impact, I think, by the ability to analyze patterns, to be able to pull out those data points, the small little pieces that those of us who are in it every single day may not be able to see, and also to be able to aggregate such large amounts of data at one time is going to be critical. So AI is already playing a huge role in the staffing industry in general, and it really allows for the elimination of a lot of those manual tasks. So the changes, the shift swaps, I spoke earlier about back in the day, we would, slide notes under the door and say, hey, can I have this day off? Hey, I'm swapping with this person. All of those are manual things that take nurses and nursing leaders away from the bedside. AI enables us to do away with that manual piece, which really gives clinicians what they want the most, which is time back with their patients. That's what they're looking for. So I really think that it's going to be revolutionary just in healthcare staffing in general, particularly when we look at everything that AI has done just in the last 5 years and how far we've come, to be able to pull all of that old information, that historic data, and make plans for what staffing needs to look like for hospitals, because each one's a little different. Each one has their own little nuances. So having the technology at your fingertips to be able to analyze that and not have to use the brain power necessary to do it yourself, it's huge, the amount of time that leaders are going to get back in their day.
Yeah, and it's one of the things that I want to add to that I've kind of noticed just in general across scheduling period is that a lot of times organizations will make policy changes that impact time off, availability, all these things, right? And don't necessarily understand the impact they're going to have. And I think AI is going to help guide policy and changes and what they allow their employees to do in a very positive way. One, to help the employees, but two, to have less of a impact to the ability to service their customers. Where in healthcare, that's you and I, right?
Yeah.
We're all the people who that they're servicing, and I think that's going to be tremendous. So what are some specific technology that you're seeing leveraged out in the healthcare industry right now to help maximize the effectiveness of existing workforce?
I've got to talk about UKG's workforce management systems. Truly, it is something that I utilized myself when I was boots on the ground in a hospital, and the strides that have been made there, the ability to have real-time analytics, huge. Again, we talk about staffing to census, staffing to acuity, to be able to tell where are the heaviest load of patients and how do I send my most qualified nurses with the highest level of certification there. Predictive scheduling, again, being able to sort of see what's going on, based on trends, based on data that's been collected, and I think even demand forecasting, which that applies to a lot of different industries, not just healthcare. What I also love is mobile. So mobile functionality, giving the clinicians, giving the nursing staff, giving the nursing leaders what they need at their fingertips, whether it's on their phone, whether it's on a tablet, to be able to carry everything that you need around your schedule, particularly if you're, let's say, a staffing manager for a multi-system healthcare organization. To sit there with your iPad and be able to control staffing across 5, 10, 15 different locations truly is revolutionary, and again gives that opportunity to give time back at the bedside, give time back to taking care of the people, making sure that your nurses have what they need, giving them appropriate breaks so they're not getting burnt out there on the floor. And I really think that it's going to maximize the workforce that way. It just lets people work smarter, not harder.
Absolutely. And you mentioned something there towards the end that really kind of got my attention, and that was the word burnout. You want to talk about a stressful situation, right?
Oh,
I mean,
gosh.
a lot of us would like to say, hey, we're getting burned out, but let's be real, right? We're not working in life and death situations where a lot of
Yep.
these nurses and other people are. What do you think the impact of all of this is going to have on that burnout factor in the healthcare industry?
I think it's going to be huge, and I think it's critical that is addressed. Nurses are leaving the bedside en masse because of burnout. They're telling us, they're crying out for help, saying we simply can't do this anymore. And I think it's going to give organizations the opportunity to call that for what it is and put the power back in the nursing staff's hands to make those choices for themselves. To be able to select their own schedules in and of itself is huge. I'm a mom. I want to be at my kid's soccer game. I know all the other moms out there and the dads out there are the exact same way. So it's a lot different to be able to tell a staff member, hey, we're going to give you the power to make the selection and work these days that mean the most to you. We're going to give you the opportunity to swap shifts with a peer or a coworker when you simply just have too much going on. You don't want to use a sick day. It allows for just better shift rotation to, again, view those patterns and see what's happening. I'll share a quick anecdote here. A hospital I worked at, who shall remain nameless, when I came in to run their staffing department, I realized that a PCT, patient care technician, had worked 45 days straight. 45 days, 12-hour shifts. And it has stayed with me essentially my entire career because they felt like they needed to do that. The organization was short-staffed. They kept asking for volunteers. This person said, okay, well, I need the money. I'm going to sign up. Imagine that person going home at the end of a 12-hour day every day for 45 days straight, knowing what they were seeing, dealing, with difficult patients or really tough situations, on their feet all day, never having a break. And it wasn't until we started leveraging technology that we were able to see that and go, hang on, there's got to be a better way. There has to be a different opportunity for us here to make this person's life better, to make our schedule better, and frankly, it's safer for the patients. And that's what this technology is letting us do that we simply couldn't do before. Because it's hard to see that right in your face when you're scheduling on paper or you're just jotting dates down on a calendar that's hanging up in someone's office. And there are still places that are doing that. And then those people are going out and taking care of patients every day and then having to go home and take care of their families and themselves. It's a recipe for burnout. It's a recipe for disaster.
Well, it's a recipe for a whole lot of opportunities for failure too. I can't imagine that. I mean, I come from more of a retail background where, come holiday season, 60, 70 hour weeks, nothing to it, right?
Yeah.
But man, to be in that type of situation, 45 days on a road, 12 hours a day, I mean, they had to be a saint. But the reality is
Right.
that, you're such a risk of actually things happening that you can't, are beyond your control too. It's a bad situation to put an employee in. It's awesome that we have those tools and that technology and those things that we can put in place to help prevent that going forward.
Absolutely.
All right. Let's jump to another topic now, related in some ways, right? But it's around recruitment and retention. Recruiting and retaining clinical staff seems to be a constant struggle in the industry, right? I mean, I don't want to compare the responsibility to like teachers and education, but wow, it's hard to keep teachers nowadays.
Yeah.
I mean, having two members of my own family in that part, it's like if you walk in and you have a pulse, they'll just about hire you to be a teacher nowadays, which is unfortunate. The retention and everything else is just a struggle. It's at a different level when it comes, to nursing and the clinical staff. So can you talk a little bit about that and how technology is making a difference here?
Yeah, and you're absolutely right. It is a significant issue and one of the reasons that staffing, frankly, is such a crisis in the healthcare space because our ability to recruit and retain highly qualified staff is really year over year, just diminishing. So tech really lets us sort of transform, the recruitment process by letting us find the right people faster, frankly. So when you have an open position and you've got 75 resumes that are coming in the door, best case scenario, right? That's a great thing. But to be able to parse through those really quickly and pull out exactly those skills and attributes that you're most looking for, it helps speed along the process from an actual hiring standpoint. It also makes sure that we're matching up candidates that have the certifications that we're looking for, but also as AI gets better, as we had talked about before, it's letting us even sort of have predictive analytics around who has the most potential. Is this somebody who maybe they're brand new in their career, but just based on what we've seen from their background and what they say about themselves, in their resume, is this somebody that we can bring on and retain? Is this somebody that has leadership potential? So again, leveraging the technology in that way to pull out some things that maybe otherwise wouldn't be seen is going to be critical. Also on the retention side, there is technology that exists that enables us to see when somebody frankly is a flight risk, they're at risk for leaving. So to be able to look at all of those different attributes of an existing employee and say, I think we're in trouble here. This person is less engaged than they used to be. They're calling in sick more often. They're not picking up shifts when they used to, not swapping with their coworkers. What's going on here? It gives us an opportunity to see in advance that a problem's coming, because it is, at the end of the day, significantly better for the organization and frankly better financially to keep the staff that we already have, to retain those nurses who are already at the bedside, than have to recruit and hire a new one. So using that technology and leveraging those predictive analytics, it gives us a better picture. And frankly, we talked about burnout a little earlier. It lets us see that people are at risk there, that they're teetering on the edge. And ideally, as leadership, we step in and we intervene and we're able to save that person and keep them with the organization. And I think that's going to be huge. And it's an area where a lot of the hospitals I work with today aren't necessarily focusing on. They want to know what they can do. They want to see how to retain employees and how to take care of them in this way. But this is so new that many of them, frankly, aren't leveraging it yet. So it's an untapped opportunity for sure.
Absolutely, I would agree with you, right? And I think, a lot of organizations have been focused on other solutions that seem a little simpler, like traveling nurses or other things, right, where they can just fill in the gaps, which quite frankly is a very expensive solution.
Very much so.
And nothing against traveling nurses at all. They serve an incredible benefit for us in the industry, but there is a way to make it more efficient, more effective, and frankly, just make people happier that are working on a day-to-day basis. And I love that. There are a lot of platforms out there in the industry, but what are some of the ones that you're seeing being leveraged to streamline that process from hiring to all that retention out there? What are some solutions you can throw out there right now that could potentially help?
Yeah, so again, I feel like AI has really been the key theme of this conversation, but it's true, and that it really is revolutionizing healthcare as we know it in so many different areas. Recruitment platforms and talent management systems previously, I would say 5 years back, were relying on AI, but not in the best possible way. It was more they were churning and burning through resumes. They were just looking for very specific keywords that they would then pull out, and they were missing a ton of great talent. So the AI recruitment and talent management platforms have really stepped their game up in terms of allowing for things like culture fit, seeing, like I said before, predictive analytics of, this person potentially would be a good fit for leadership down the line, or this person would be ideal for a critical care role. So leveraging those different tools instead of just using it to churn through resumes as quickly as possible, trying to find one or two words that match the applicant tracking system, give us the opportunity to have those real-time insights into what's happening in the recruiting space. I also think mobile-friendly interfaces, if you make it easier to apply for your jobs, if you make it more prevalent out in the industry, people are going to naturally gravitate to that versus some platforms out there that I certainly will not name names, but if you go on LinkedIn, you will see all sorts of posts of people bemoaning it. Upload your resume. Now retype everything from your resume that you just uploaded into this form. Now do it again, and now get a different login, and now you have a different username. And the tools and technology that are moving as far away from that as possible to keep it as quick, as streamlined, and user-friendly as possible are going to be the ones that see the most impact for an organization.
I have to laugh at that a little bit. Having not too long ago recently gone through my own process of applying for jobs and looking for jobs, if it had an easy apply link from LinkedIn, I'm in.
Yeah.
But if I had to upload it and then start retyping stuff, I start looking at, do I really want to work for this company?
Right.
Are they innovative? Are they cutting edge? Are they doing the things that are effective? It says so much about your business when you look at the technology you're leveraging and how effective it is for their employees.
Absolutely.
And future employees for that matter, right? You can't forget that, you have to focus on those you want to hire as well, not only those you have. So I think that's fantastic. So, all right, so let's move on a little bit to employee engagement and well-being.
Oh, yeah.
Employee engagement and well-being is, one of the top priorities, especially after the pandemic, right?
Mm-hmm.
I mean, the pandemic, for all the good and the bad out of it, the one thing it did, it was change the focus of people. Mm-hmm. And what I mean by that is they look at their job very differently than they did 5 years ago. So how is technology helping there?
So you're so right that COVID was a game changer in so many industries, but especially and specifically in healthcare. So the reality of the situation is there are, nurses and doctors and respiratory therapists and techs and phlebotomists and, clerks at the front desk who went to work every day through that while the rest of us were safe at home. There are people who lost their lives because they went into work to take care of these patients, got COVID themselves, and didn't survive it. And it has created a seismic shift in the industry of people truly looking at what they're doing and deciding, is this for me? And for so many people, the answer was no, it's not worth it. I want to be here for my family. And for others, it was yes. I say all the time, healthcare really is one of those things. It's a calling that it just kind of keeps you in, even under the worst of circumstances, like we saw with COVID. So technology has had to be a game changer now that we've sort of emerged in this. Of course, COVID is still going on, but the post-lockdown world, basically, that we've lived in. So utilizing technology and platforms that give employees an opportunity to share real-time feedback, say, this is how I'm feeling, this is what's going on, this is what we're seeing out in the units, allowing them to receive recognition, not just, hey, there's a pizza in the break room, and a pat on the head, thanks for doing a great job, but sending push notifications to their phone to say, we're celebrating the work you're doing, we see you out here, your patients are raving about you. It's critical. They have to have not just that intrinsic motivation that keeps them coming to work every day, because that's healthcare. We do it because we love it. We do it because we love to take care of people. But also those reminders from the organization that we're connected here. My workplace cares about me. They're listening to me. And technology has let us do that in new ways that has, I think, really been accelerated since COVID, because there's an understanding that there has to be something else. There has to be the mental health support, the work-life balance support, the resources for exercise and eating better and all of those other things that make up the whole employee versus just, hey, here's a way to clock in and out or view your paycheck. And I think technology really has come so far, even just in, the 20 years that I've been in the industry, for really seeing that employee as a whole person. And it forces organizations to acknowledge and take action when it comes to their well-being.
Perfect. I can't, the impact it's had on the healthcare industry is by far, I think, the greatest across all industries for sure coming out of COVID. And I've seen the impact on individuals themselves, and you mentioned it, people actually deciding to vacate the industry, go do other things. Right. For lots of decisions. I've also seen the impact of it having from a mental health standpoint. Mm-hmm. And some of those things you talked about I think are phenomenal but people get motivated by different things. People, stand up on different things. What are some other tools and applications that you've seen kind of prevailing from that, impact that are helping people today to cope with the stress and to cope with the impact it's having on them?
Absolutely. I love this. And I would like to say before I state any of these, we're not sponsored, but certainly don't mind. So, if any of these apps I'm about to throw out at you are listening, be sure to call us. So a lot of things focused around mental health, which has been so critical. So one of the things I love telling people about the Calm app, CALM, it is a meditation, mindfulness, a kind of all-inclusive app. But during COVID and even post-COVID, they were giving the app away for free to healthcare workers. So acknowledging what a terrible headspace so many of them were in, of the fear and the uncertainty, and just leveraging a tool like that to help them get through it. I think that's amazing. There's another one called Headspace. So I've not used that one personally, but very similar in terms of different soothing stories that you can listen to, breathing exercises. There's mental health platforms that offer counseling, BetterHelp. So you can do text therapy with a licensed psychologist. So if you are somebody who very much was on the go, working 6 shifts in a row and not having the opportunity to go and sit down on a therapist's couch and kind of get things off your chest, to be able to shoot a text message and communicate that way. So again, technology has stepped up to meet the demand of just a really, really busy life and workforce that we're in today. And I really think that healthcare workers have really just forced the industry to make those changes, because if you work a 7A to 7P shift, you're not making it in to see your doctors the way you need to. So being able to leverage a virtual, check-in with your urgent care has really been critical. And to then take it a step further, so there are mechanisms and apps to help them manage stress and do a better job at work-life balance. It's great to see what technology has done for the industry.
Fantastic. A lot of the things you've gone over in the last few minutes was talking about how it's helping the employee, right? Mm-hmm. It's helping those out in the field. Let's flip it. How is technology, and well, frankly, has technology provided opportunities and solutions where the employee can actually give feedback upstream to the employer?
Yes, and that I think has been critical. So we talked about this, a few questions back around, some of the different AI tools around recruitment and retention. And that is something that I think has been instrumental and has changed the game a little bit, because it has forced organizations to stay on their toes a bit, because they now have a feedback loop. It's no longer they're pushing information down to the employees. The employees are able to do surveys. They're able to tell their managers how they're feeling. They're able to submit feedback, to answer direct questions on, hey, this is how things are going, this is how I'm feeling. And those data points are critical for organizations, assuming they're leveraging them appropriately. Because there is a concept of, analysis paralysis, but also just fatigue when it comes to surveys. So if you are surveying your employees, how are you feeling? How's it going? What can we do to help you? And they keep telling you, and then you're not doing anything with the information, they're going to stop answering. So leveraging these tools and taking this intel and then building out a solution and a strategy for how do we action this? How do we make sure the employees know that we see them, we hear them, and we're doing everything we can to make things better? That is truly important, and that is an area where the technology exists, but I'm not seeing a lot of organizations in the industry yet fully embracing it. They don't know how, and no fault of their own, it's new. But having a strategy around that is critical when you talk about just the long-term retention of your staff.
Agreed. I think you hit one of the key points there, right, is people aren't sure how to use it, how to gather it, what to do with it, which kind of takes me down a little bit of a sidetrack here, talking about AI in general. Right, some people are scared to death of AI, right? Oh, yeah. They're like, oh man, it's going to take over everything. No, it's not. Okay, let's be real. Okay, AI is steal an output of what we put into it.
Right.
Which kind of ties into the data and the feedback and everything else that we need, not only from our employees and out from the field, but we also need to make sure that what we're feeding into the AI to do the assessment that it's doing, which is incredible, it's got to be good data. It's got to be good information. That kind of ties back to what you talked about, the evolution of where it's come from 5 years ago from the recruitment perspective, right? It's because the inputs have gotten better, the analysis of who's performing well and not performing well. Always remember, though, there's going to be exceptions to what AI predicts as well. So while it is an incredible guide and it's an incredible asset to leverage, there are exceptions. So don't be blinded by the fact that, hey, they don't fit into this mold, they don't fit into this box. There are still uniquenesses, and the outputs are not always going to be the same, which is incredible. But I think AI is just going to continue to impact us in a very positive way, but it comes back to how you leverage it, how you use it, and making sure you understand how you want to use it as you move forward.
That's it. It's a tool. So it's as good as the information that you put into it. And it's the craziest thing. If you load up ChatGPT and you give it a bunch of information and feed it a bunch of intel, it's amazing what it's able to spit back at you. But if you feed it the wrong information, its outputs are going to be wrong as well. So being really intentional with it, not being afraid of it, but understanding it for what it is, I think is really important. And listen, in healthcare in particular, you really have to be careful. There's, protected health information, the privacy of patients is of utmost importance. You're certainly not going to start feeding, patient data into ChatGPT and saying, hey, tell me what comes from this. But if you are able to wisely leverage the tool in front of you, it can really just transform the way you do business, as long as you treat it and understand it as such. And everything you said is completely spot on. And I think the more people start to understand that, the less fear they're going to have. Alexa and Roomba are not rising up to take over, the world, not today anyway. But we can make things better through AI and through technology, as long as we're using it wisely.
Okay, I agree with you there, except for one point. If you ask my dogs, Roomba is trying to take over the world.
Actually, that's a fair point. I think my dogs think Roomba's taking over as well. They've got it handled. They figured out how to corral her right into a little corner, because, of course, our Roomba's a she. So they corral her right into the corner. And don't worry, my dogs will protect us when the Roombas rise up.
Absolutely. And by the way, if you don't believe that, the output is a result of your inputs, go out there and have fun with ChatGPT. Put about 5 things in there that you want it to kind of recap, and then throw in a couple of abstract things. See what happens. It gets really funny, and that's kind of a fun thing to do. All right, so let's move on to our next topic. All right, sir, we're coming close to wrapping up here, right? But this has been an incredible, fantastic conversation. I look forward to future conversations around some of these topics as well. So let's jump to kind of some broader topics and some broader insights as we wrap up here. Put on your thinking hat. Get your crystal ball out, whatever you want to call it, right? If you could predict where healthcare technology is headed in the next 5 years, or even 10 years, or whatever, right? Or next 2 years, what are some of the big things that you see coming, and where do you think it's headed?
Ooh, all right. I need to jot down the date and time, so in 5 years when this all comes true, we'll know I'm a little psychic. So we have, again, talked so much about AI, so that goes without saying. The artificial intelligence is only going to continue to get smarter, more effective, more efficient. Goes without saying that that's going to have an impact on the industry. But I also think that there's going to be a lot more automation around some of the tasks that, for those of us that come from healthcare, just for so long have felt it's just part of the job, right? When it comes to charting, things of that nature, information in the Pyxis to pull our medications, there are opportunities to automate so many different workflows today that we're not able to fully leverage. And I really feel like that is probably going to be a primary focus in the next 5 years, because there is more and more attention around the fact that giving clinicians time back at the bedside is better for everybody. it's better for the nurse, it's better for the doctor, it is surely better for the patient, and it's better for outcomes, which means it's better for the hospital or the organization. I think the issue with that is because it is still so new and people don't know where to start, there's opportunity to leverage organizations, frankly, like ours at Improv, that can bring somebody in and say, here are the processes that are taking up the most amount of time for your workforce. Here's the way you can automate them. Here's the way that you can develop workflows that take time away from those manual tasks that are frankly just a drain, on clinicians and, even administrators. And here's how we can build a strategy and take you on the journey of what automation can look like for your organization. So I think that there has to be, frankly, an investment from organizations out there who say, we see what the future looks like, we want to be a part of it, we don't want to be behind the curve, because that takes us back to the recruitment issue, right? Nobody wants to go work for the hospital that is still living in the 80s, and paper charting and, doing all those things. So being able to have somebody come in and look around from an outsider's perspective and say, let's build a strategy around this. Let's build out a roadmap for what the next 5-10 years of your organization looks like, so that you can then tie in some of these key, attributes of technology. I think is going to be huge. And again, it's more technological focuses on the employee, on their well-being. I think that conversation is not going away. And if anything, COVID taught us that we have to be dialed in to the well-being of staff, to their mental health, to their work-life balance. And I think from a technology standpoint, we're going to continue to see that in the industry, because everyone involved realizes what a terrible situation we'll be in if all of the nurses just decide they want to go be teachers, or they want to, go do real estate. And that's a real concern if everyone doesn't band together to do something to make sure that they understand that we see them for the heroes that they are, and that we're going to do everything possible to protect them.
I 1,000% agree with you there. I mean, I think that prevails across all industries, but nowhere greater than any healthcare industry, because of the stress, the impact, and what it does to the people who are working there. And none of us want that, right? But I think people underestimate the value of a happy employee.
Yes.
It leads to happy customers. It leads to better business. It leads to better results. It drives costs down. There's so much benefit to just having great and satisfied employees.
Absolutely.
I think it was buried in everything you just said, but if you were speaking directly to healthcare industry leaders right now, which you are, what's the one thing you want them to take away from here that they should be focusing on right now?
Your people. You have to focus on your people. That is going to be critical to your business, to your outcomes. So leveraging technology is one thing. It's going to help your business. It's going to, have a significant ROI, but your people are your most valuable asset. So even having an opportunity to invest in a way that's going to pay off dividends, to make sure that you have left no stone unturned in ensuring that your people have an optimized workforce, that their staffing is as clean as it can possibly be in an industry like healthcare, that your employee well-being platforms are fully optimized and giving you the data and information that you need to take care of those folks. Finding technology that's enhancing the human experience behind those who are taking care of your patients is going to be just of the utmost importance. So invest in that technology, invest in the solutions, invest in the people who can come in and say, again, from an outsider's perspective, knowing what's happening out in the industry, this is what you need to be successful. Let us help you get there. Let us help you build a plan to ensure that the people you have at the bedside right now continue to be at the bedside 5 years from now, that they're happy, they're engaged, they're taking great care of your patients. Because at the end of the day, none of us are anywhere without the people in healthcare. You and I both walk into an urgent care and can't get seen. My father walks into an emergency room with chest pain and has to wait 4 hours because they don't have nurses. It's unsustainable as a society. So healthcare leaders have got to take action, invest in the resources necessary to make sure that your organization is seeing the demand, seeing the need, and doing something about it.
Fantastic, and I agree with you. Look, it's been a great conversation. I've really enjoyed this. We're gonna hit on some more key topics that really challenge the healthcare industry in future podcasts. I do want to take a few minutes here, though, and honestly, this is a little bit of a push on improv, right? That if you like what Sarah had to say, if you like what I had to say, and you're more interested in learning more, please reach out to us.
Absolutely.
It costs you nothing. It costs us nothing to have a conversation and talk about this and help guide you and lead you in the right direction. We're excited about where the industry is going. We're incredibly enthralled by what has happened over the last 4 or 5 years. It's amazing what's happened, and we are on the cutting edge, and we want to stay a part of that, and we want to help you as an organization out there be a part of that as well. I find it very interesting. I think some of the smaller organizations are more efficient and more effective at taking advantage of where the industry is going than some of the larger ones, where that's where the biggest opportunity truly is. But this is for everyone, right? I mean, no matter the size of your organization, the future of where you're headed, the direction you're heading, it's a sound investment to make sure you're taking care of your people, you're doing the right things, and at the end, taking care of us as individuals, as your customer as well.
Absolutely.
So thank you, Sarah, for the time today, and look forward to many more conversations.
Sounds great.